So now you're at the preoperative area. So when you get to the hospital, you will check in at the front desk, and then a volunteer will bring you up to the surgery floor where you'll meet with the preoperative nurse. They'll review your medications with you, confirm which pharmacy you would like to have any of your medications sent to. We'll have you get changed into a gown. We'll prep and cleanse the skin on your leg again. They'll start an IV, get some fluids running, check your vital signs, and we'll have you use the restroom as well prior to going into surgery. At this time, you will also meet with the anesthesiologist and your surgeon, and they will go over the plan for surgery and make sure that you are comfortable with everything. Now it's time for surgery. So after you've met with the surgeon and the anesthesiologist, it's time for surgery. So they will help give you some medications to help you relax a little bit before the surgery, and then they will wheel you back to the OR. They'll have you get on the operating table. This is when you would receive your spinal, and then surgery would begin. So surgery is over with. Now it's time to head to the recovery unit. So once the surgeon is finished with the surgery, you will be transferred to the recovery unit where you will be monitored closely by a nurse while you're waking up from anesthesia. They'll make sure that they're monitoring your vital signs, your pain, breathing, make sure that the dressing looks good, as well as do an ultrasound of your bladder to make sure that you're not retaining too much urine. Once you fully awaken, you're feeling good, you will be transferred to the orthopedic unit. So once you get to the orthopedic unit, there's a couple things that you're going to have to do. First and foremost, we'll have you transfer from the bed you were on in the recovery unit to the bed up on the ortho floor. We do ask that you do not get out of bed on your own. Even if you're feeling really good, medications are working, we ask that you always have somebody there with you to help make sure that you're safe getting up. The nurses, once you get up there, will do frequent vital signs and assessments, make sure that everything is going well, you're feeling good. And then you do have 5 things that you're going to need to accomplish before you're able to go home. So first and foremost, you're going to meet with physical therapy, and if you have a hip replacement, you will also meet with occupational therapy. You will need their blessings to leave the hospital. They're just going to make sure that you're moving well and that you have a good understanding of your physical therapy exercises. You do also need to be able to eat without getting nauseated at all, as well as urinate and empty your bladder. You will have to receive 1 more dose of IV antibiotic, and we have to make sure that your pain is manageable. If you're able to check all 5 of those things off, you are free to go home. So now we've got to cover a couple things for while you're at home. First and foremost, we just want to touch a little bit on diet. So once you get home, there's no restrictions with your diet. You can resume a regular diet. We do just ask that you eat some healthy meals. So it includes like fresh fruits, fresh vegetables, as well as other foods containing fiber. We do want you to also increase your water intake to help prevent constipation from occurring, as well as drinking a sports drink once you're home too. The sports drink is just to help prevent any dizziness or lightheadedness that can come from electrolyte imbalances after surgery. Now it is important to eat a healthy diet as well, because that's going to help you heal better too. If you've got the appropriate nutrition, you will heal. Appetite. So it is normal for patients to have a decreased appetite after surgery. That is completely normal. It is one of the things that happens after anesthesia. So to help with that, we ask that patients just try and eat small, frequent meals if you're not really having much of an appetite. And just make sure that those small meals are healthy meals. So next, I'm going to talk about icing and elevating. So these are going to be some of the best things to help you decrease your swelling and help keep your pain under control. So for icing, we do ask that you ice for 20 minutes out of every hour, and that can be at any time throughout the day when you need it. We do also ask that you elevate your surgical leg throughout the day. We ask that you keep it at or just above the level of your heart 3 times a day, and this usually works best if you are laying on a bed or couch with your upper body flat. Next is activity. So we want to make sure throughout the day that you're doing your physical therapy exercises anywhere from 2 to 3 times a day, just to make sure that you're working on that strengthening, getting good range of motion with your joint. We also ask that you do take a short walk every hour. Now, it doesn't have to be a long walk at all. It can be just to your bathroom and back, or to your kitchen and back, just to make sure that you're getting up, getting your blood flowing, and keeping your joint from getting too stiff afterwards. We also ask that you make sure that you keep any outpatient physical therapy appointments that you have afterwards. Working with those outpatient physical therapists is very important to make sure that you get good use out of your joint replacement. Lastly on this slide is just going to be talking a little bit about sleep. So it is completely normal for some patients to struggle with sleeping after surgery. The sleeping patterns are disturbed because we're having you come in for surgery, and then there is also the pain that can be in the joints as well. We do ask that you don't take any medications to help sleep, as they typically interfere with narcotic pain medications. Next up, I do want to talk about medications. So there are a couple types of medications that are going to be prescribed for you by the surgeon. That includes things like anti-inflammatory medications, narcotics, anti-ulcer medications, and blood thinners. And there's also a list of medications that we ask that you buy over the counter or after surgery as well. So talking about pain and how things are going to go after surgery. So you receive the local injection of anesthetics around your joint on the day of surgery. Now that usually lasts for anywhere from 12 to 24 hours afterwards. So once that starts wearing off is when you're going to notice a real increase in pain. That is completely normal. We do send you home with pain medications to help manage this pain afterwards. So as a rule of thumb, pain is different for every single person. There is no one trick that will work for everybody. So that's why we have a multimodal approach to your pain, and we give you a couple options of what you can use. Now, if you are anticipating pain, that helps because it lets you realize that our goal is that your pain is manageable so that you're able to get up and walk around and you're able to do those physical therapy exercises. So managing your pain, we want to make sure that you're utilizing oral medications that we send, you're icing, you're elevating, you're changing your position. And we also recommend to patients that you try and take pain medications about an hour before your physical therapy or your exercises at home. So some side effects of narcotic pain medications that we just want you to be aware of. First and foremost is constipation. So that's why we recommend that you eat fresh fruits, fresh vegetables, you take a stool softener. Some patients can get upset stomachs with narcotic, as well as dizziness, lightheadedness, some confusion, unable to empty your bladder, and sleepiness as well. If you're experiencing any of these symptoms and they're unbearable, we do ask that you reach out to us at your surgeon's office. Medication refills. So we do refill narcotics for our patients after surgery. We do just ask that you call us between Monday and Thursday between the hours of 8 and 4:30 p.m. We ask that you try and call 24 hours before you need the refill so that we have the appropriate amount of time to get that refill approved and sent to your pharmacy for you. No refills will be given after business hours, on weekends, or holidays, so we do ask that you try and plan ahead. Next, I want to talk a little bit about blood thinners. So all of our patients will be prescribed a blood thinner after surgery to help prevent any blood clots. So the blood thinners will be the first thing that we use, but there are a couple other things that we have patients do to help prevent blood clots as well. That includes that short walk once an hour, performing your ankle pumps, trying to drink plenty of water, and taking your blood thinners. So some things to look out for with blood clots. So if you notice any significant calf swelling, redness, increased pain, redness, heat, they could be signs of a blood clot in your leg. We want you to call your surgeon's office immediately. Now, if you notice sudden shortness of breath, pain with breathing, as well as like a bloody cough, those are all signs of a blood clot in your lungs, and you're going to want to call 911. Next is constipation. So this can be common after surgery. So reasons for this: anesthesia and narcotic pain medication use, the stress from surgery, as well as decreased activity and dehydration. So some of the symptoms that we ask that patients look out for would be less than 3 bowel movements a week when you're straining to have bowel movements. The bowel movements that you're having are hard, dry, or small. If you're feeling full or bloated and you've got pain in your lower abdomen, and if you have no relief after your bowel movements. So some of the things that we ask you to do to help prevent that constipation would be taking laxatives, adding in Miralax as well, drinking plenty of water, slowly increasing your fiber intake, and keeping up with those short walks every hour. Now, dizziness and lightheadedness. Now, this is something that's normal to experience the first day after surgery. If you are experiencing this, we do ask that you try and move and change your position slowly. If you are experiencing it and it just doesn't get better when you sit up slowly, we do ask that you lie down and elevate your legs to help get some of that blood flowing back to your heart. Once things feel better, your symptoms are improved, we do ask that you try and make sure that you're drinking adequate fluids. So this does include water, but we also want you to stagger that with sports drinks or possibly some soups and broths as well. You can also place a cool compress across your forehead and if you're trying to have a bowel movement as well, try and avoid bearing down, as that can cause a lot of dizziness and lightheadedness as well. Just want to take a moment to talk about reaching your goals as well. So it's important that you have goals in mind for yourself after surgery, something for you to continue to work on. So some of our goals that we give to patients is that you're performing your physical therapy exercises 2 to 3 times a day. You're icing and elevating your leg throughout the day. You're eating 3 healthy meals. Those healthy meals are going to really help with your healing afterwards. That you're trying to get 7 to 8 hours of sleep each night if you can. The road to recovery can be a long one, so we just want to make sure that you're taking it day by day and that you are listening to your body and what it's telling you. Next is infection prevention. So a couple of things that we want you to be looking out for after surgery when it comes to an infection. So we want you to be looking out for any significantly increased pain, redness, swelling, like drainage that's yellow, green, it's got a real foul odor to it, as well as large amounts of bleeding too. Look out for any fevers over 101.5 degrees. So after surgery, there will be a dressing over your incision. We want you to keep an eye on that dressing and make sure that there's none of that bleeding or drainage coming from there and that you're keeping that dressing dry. One of the other big things that's going to help prevent infection is good hand washing. If you're properly washing your hands, it's going to be the best thing you can do to help prevent infection. We do ask that you do not soak your incision at all after surgery until it is fully healed. So that does include like no baths, hot tubs, pools, or beaches. We also ask that you try and limit your exposure to sick people if you can, as well as try not to touch the incision or the bandage at all if you don't have to. Some other considerations for once you're at home as well. So with sleeping troubles, if you are noticing that, some things to do to help that would be trying to avoid taking naps throughout the day. And like I mentioned before, don't try and avoid taking sleeping pills while you are on narcotics. Melatonin is the exception that is safe to take to try and help you get sleep. Also, a recommendation we have for some patients is just to try and add some white noise in. Another thing too, if you notice signs of infection in any areas other than in your surgical area, we do ask that you follow up with your primary care provider. And sources. So I would just like to extend a thank you again to you for choosing Bellin and coming and seeing us. Now, if you have any questions regarding anything, you can always feel free to reach out to your surgeon's office and we will help you out as best we can. Thank you.